My dear students, today our focus is psoriatic arthritis. As far as psoriatic arthritis is concerned, first of all, we have to remember that there are multiple types of arthritis, like the rheumatoid arthritis, like the osteoarthritis, and the psoriatic arthritis as well. We have to distinguish these types of arthritis from one another. Before going to the arthritis of psoriasis, we have to remember that psoriasis is a dermatological condition, a chronic inflammatory dermatological condition in which we have got the presence of scales on the extensor aspect of our body due to increased keratinocyte proliferation, in addition to having multiple important phenomena like the cobbler's phenomena. This psoriasis is a chronic disease and it can be complicated by nail changes as well as arthritis. As far as the arthritis specifically is concerned, the psoriatic arthritis is a chronic inflammatory arthritis, and usually 5 to 30% of the patients with the dermatological problem of psoriasis have arthritis or develop arthritis. Not all patients with psoriasis develop arthritis. That is to be remembered. In addition, you have to remember that it has got a typical HLA association, HLA-B27 to be more specific. HLA-B27 happens to be associated with rheumatoid arthritis as well. Just by the way, in addition, you have to remember that there are these typical nail changes, and the psoriatic arthritis is of 5 different types. The most common being the asymmetric oligoarthritis. As is clear from the name, it is not symmetrically present and it affects the smaller joints, especially the distal interphalangeal joints, the small joints of the hands, the small joints of the feet. Sometimes the knee joint can also be affected, and there are those typical sausage digits characteristically associated with asymmetric oligoarthritis of psoriatic type. The second most common variety of the psoriatic arthritis would be symmetric arthritis. In addition, the third type would be the predominantly distal interphalangeal joint involvement. The fourth type would be the arthritis mutilans, and it is a question quite commonly asked. Arthritis mutilans is a severe, aggressive, destructive and deforming arthritis characterized by bony deformities and severe joint deformities. It happens to be the more severe variety of arthritis. The fifth one would be the spondylitic or the sacroiliac type, in which there will be associated sacroiliitis. Sacroiliac joint inflammation would be characteristic of this fifth variety. So 5 types: asymmetric oligoarthritis, symmetric polyarthritis, distal interphalangeal arthritis, arthritis mutilans, and spondylitic or sacroiliac type. Now, what is important about the lab features of psoriatic arthritis? Very important fact is that there might be increased ESR as well as increased C-reactive protein, in addition to one feature, hyperuricemia. That might be an association with psoriatic arthritis. Now, as far as the radiographic features are concerned, you have to remember that there might be a whole range of features seen, like the bony erosions, in addition to bony ankylosis, as well as the resorption of the terminal phalanges, in addition to pencil in cup deformity. A question quite frequently asked: pencil in cup deformity is associated with, remember, psoriatic arthritis. In addition, there might be sacroiliitis and syndesmophytes at late. Sacroiliitis tends to be a later manifestation, a chronic manifestation of psoriatic arthritis. Now, how do we treat psoriatic arthritis? A well combined plan of education, training, rehabilitation and education. Patient education is the first step. In addition, we use multiple types of drugs. Some of the drugs which are also used in rheumatoid arthritis, like the anti-TNF agents, tumor necrosis factor, anti-TNF agents, etanercept, infliximab, golimumab, and elfacept. Elfacept is used in combination with methotrexate. Some of the physicians would recommend gold salts as well, in addition to antimalarials. So we have a whole range of drugs, the anti-TNF agents being predominantly used for treatment of psoriatic arthritis. I hope that you just remember all these points about psoriatic arthritis because it is a question quite commonly asked as a clinical scenario. I wish you good luck for your exams and hope that you fare well in your exams. Thanks a lot.